Why is the U.S. healthcare system the most expensive in the world, while delivering worse outcomes than other advanced economies? This question lies at the heart of policy debates about fairness, efficiency, and public health in the United States. To understand this paradox, we need to explore the systemic, structural, and economic factors that contribute to the high costs and suboptimal results of U.S. healthcare. One of the most significant drivers of cost is administrative complexity. The United States operates a fragmented system involving a mix of public and private insurers, each with its own rules, billing requirements, and reimbursement models. This creates an immense administrative burden on healthcare providers, who must navigate these systems while managing claims disputes and compliance. Studies estimate that administrative expenses account for 15-30% of total healthcare spending in the U.S., substantially higher than countries with single-payer systems, where such costs are far lower. Prescription drug prices are another major contributor. Unlike most advanced economies, the U.S. does not regulate the cost of medications. Pharmaceutical companies have, the freedom to set prices, often leading to costs that are significantly higher than in other countries. Extended patent protections delay the introduction of more affordable generic drugs, and direct-to-consumer advertising, legal only in the U.S. and New Zealand, encourages patients to request expensive brand name treatments, further inflating costs. The cost of medical services also plays a significant role. The fee-for-service model incentivizes healthcare providers to prioritize quantity over quality, encouraging more tests and procedures, even when they may not be necessary. Additionally, the lack of price transparency leaves patients unable to compare costs, while market consolidation among hospitals and specialist groups limits competition and allows large providers to set higher prices. Chronic disease prevalence is another critical factor. The United States faces higher rates of obesity, diabetes, and heart disease compared to its peers. These conditions drive demand for long-term care and expensive treatments. Unfortunately, the system has traditionally focused on treating illnesses rather than investing in preventive care that could help reduce the prevalence and cost of chronic diseases. Inequities in access further exacerbate the problem. Despite the Affordable Care Act expanding coverage, millions of Americans remain uninsured or underinsured. Many delay care due to cost concerns, leading to worse health outcomes and more expensive interventions when they finally seek treatment. Significant disparities also exist along racial, socioeconomic, and geographic lines, creating further strain on the system. Provider compensation adds another layer of expense. U.S. doctors and specialists are paid significantly more than their counterparts in other advanced economies, driven in part by the high cost of medical education, which often leaves providers with substantial debt. While competitive salaries are important for attracting skilled professionals, they also contribute to the overall cost of care. The result of these inefficiencies and disparities, despite spending nearly twice as much per capita on healthcare as other advanced nations, the U.S. consistently lags behind in key health outcomes, such as life expectancy and infant mortality. Much of this can be attributed to social determinants of health, factors like poverty, education, and housing that are inadequately addressed within the healthcare system. In contrast, nations like Canada, Germany, and the United Kingdom achieve better outcomes at lower costs by prioritizing universal coverage, regulating drug prices, and investing in preventive care. Their systems are designed to reduce administrative waste, negotiate fair prices, and address upstream causes of poor health. The U.S. healthcare system operates under a market-driven model that emphasizes profit over equity and efficiency. While this approach has driven innovation in some areas, it leaves millions of Americans underserved and imposes unsustainable costs on families, employers, and the economy. Reforming this system requires more than piecemeal fixes. It demands a rethinking of priorities to align public health goals with economic sustainability. Until such reforms are enacted, the U.S. will continue to face the troubling reality of paying more for less. Addressing these systemic issues is not only a matter of economic necessity, but also a moral imperative for a nation striving to ensure health and well-being for all its citizens. Please subscribe to the Intellectualist's new YouTube channel, where we present insightful videos analyzing the current events shaping the world. Turn on notifications to receive the latest updates from the channel.